What are the challenges of repeat Botox treatments for OAB? Imagine trying to keep a delicate balance in your bladder health while managing overactive bladder symptoms. Botox injections are a common treatment, but they come with their own set of challenges, especially when repeated over time. One key issue is that Botox effects are temporary, usually lasting between 6 to 12 months, with an average of about 7 to 8 months. This means patients often need repeat injections to stay symptom-free, which can be inconvenient and requiring ongoing visits to healthcare providers. Another challenge is that the effectiveness of Botox can vary from person to person. While many experience significant relief, some may find that their response diminishes over time. This unpredictability can make long-term planning difficult and may lead to frustration or the need to explore other treatment options. Repeated treatments also raise concerns about side effects like urinary retention, where more urine remains in the bladder after urination. About 6% of patients may experience enough retention to need intermittent self-catheterization for a few weeks after each injection. Interestingly, studies suggest that the risk of retention does not significantly increase with multiple injections, but individual factors such as gender and baseline bladder function can influence this risk. Urinary tract infections are another common side effect, occurring in roughly 14 to 18% of patients after Botox injections. Repeating the treatment might increase the chance of recurrent infections, which can impact bladder health and overall comfort. To help prevent this, doctors sometimes recommend antibiotics before or after the procedure. There are also theoretical concerns from animal studies that repeated Botox injections could cause tissue changes like scarring or reduced bladder elasticity. However, human studies involving up to 4 injections have not shown significant tissue damage, and some even suggest that repeated treatments may reduce fibrosis and improve bladder capacity. Still, long-term effects beyond this are not fully understood and requiring further research. Systemic side effects, although rare, are serious and can include muscle weakness or breathing difficulties if Botox spreads beyond the bladder. The Food and Drug Administration advises careful monitoring for such effects, especially with repeated treatments. Not every patient responds equally well, and some may develop side effects that limit further use. Therefore, careful patient selection and ongoing assessment are essential to balance benefits and risks. For individuals with a history of bladder cancer, Botox can be used cautiously, but close evaluation is needed to avoid confusing cancer symptoms with treatment side effects or complicating surveillance. While Botox can greatly improve quality of life by reducing urgency and incontinence, the need for repeated procedures and potential side effects can impact patient satisfaction and adherence over time. Overall, the challenges of repeat Botox treatments for overactive bladder involve managing the temporary nature of relief, minimizing risks of urinary retention and infections, monitoring for tissue changes, and ensuring safety through personalized care. Patients should always discuss these factors with their healthcare providers to make informed decisions tailored to their unique bladder health needs.